Hello, and welcome to Anatomy with John and Scully. Today we're talking about the Gluteus Maximus. We're going over origin, insertion, action, innervation, and blood supply. Thank you for joining. So Gluteus Maximus. Scully up. Looking at the left side of Scully's pelvis here. So the origin is going to be just posterior to the posterior gluteal line. So that lines up right about here. So just posterior to the posterior gluteal line. Okay. Second point of origin is going to be the dorsal lateral aspect of the sacrum and the coccyx. And it's also going to originate on the sacrotuberous ligament, which attaches just inferior to the PSIS, the dorsal aspect of the sacrum and the coccyx, as well as the ischial tuberosity down here. So that's the origin. Moving on to insertion, it's going to attach to the gluteal tuberosity right here. How we can find that is you can follow the linea aspera all the way to about the lesser trochanter height, and that's where the gluteal tuberosity sits. The other insertion we're going to talk about today comes from the Gluteus Maximus, inserts onto the IT band or iliotibial tract. So that's going to come down laterally along the femur, and that's going to attach and insert onto the lateral condyle of the tibia. This is also called Gerdy's tubercle. So Gerdy's tubercle or the lateral condyle of the tibia. So there's origin and insertion. Let's move on to, sorry, steps a little stiff, to innervation. Receiving innervation from the inferior gluteal nerve. Inferior gluteal nerve comes off of nerve roots L5, S1, and S2. Don't forget the nerve roots exit below in the lumbar spine. And it's coming off of the sacral plexus and becoming having a branch of the inferior gluteal nerve come off and supply the Gluteus Maximus, so it pops out through here. Blood supply is, so we have the aorta where it starts, bifurcates to the common iliac arteries, further bifurcates into the internal and external iliac arteries, popping out through here at the sciatic foramen, and it's going to be supplied mostly by the inferior gluteal artery, but occasionally the superior gluteal artery as well. And so that's blood supply. Looking at action now, it's going to extend the hip like so. It's also going to help us to laterally rotate the hip. Again, laterally rotate the hip. And it also helps us to abduct the hip. So again, it helps us to abduct the hip. So there you have it. Origin, insertion, action, innervation, and blood supply of the Gluteus Maximus. As always, do not forget to eat your leafy greens, and thank you for joining.